We're going to go now to a major overhaul parents need to hear tonight. The U.S. made a big change to vaccines recommended for children. Our chief health editor, Dr. Partha Nandi, is here to explain this and help us all understand this, Doc, and what it means moving forward for our kids.
Yeah, big changes, right? Yeah. The U.S. Department of Health and Human Services has now recommended that recently narrowed the vaccine schedule for most children. Vaccines like measles, mumps, rubella, polio, chickenpox, and HPV are still recommended for all children, but others such as RSV, hepatitis A and B, and meningococcal vaccines will be suggested mainly for children at higher risk. They also recommend that vaccines for flu and COVID-19 be considered only after talking to healthcare providers. So parents who want these vaccines must check in with their pediatrician first. The reasoning, right? What's the reasoning for this? The reasoning given is that these changes that the U.S. was an outlier compared to other developed nations like Denmark in both the number of vaccines and the number of doses recommended. But what we have to think about is that comparing with Denmark is problematic. Why? Because they're smaller, have a very different healthcare system, Glenda. Access to excellent prenatal and childhood care there is universal. Officials say that this change focuses on the most essential vaccines and is meant to build public trust. However, many experts feel like this worry that this shift could actually increase risk in some kids. And many also feel there hasn't been a transparent public review of the data supporting this change.
So what does the effect on health look like for children, families?
And that's a big question, right? Yeah. So experts warn that lowering vaccination rates might actually increase illnesses, especially in communities with limited access to healthcare. RSV, for example, can cause serious lung infections like bronchiolitis and pneumonia, which can lead to hospitalization, especially in babies. In some cases, it can even lead to severe complications or death. Hepatitis A and B, these are infections of the liver. If fewer kids get vaccinated, more could become sick, leading to hospital stays, long-term liver problems, and even death. Meningococcal disease can also be life-threatening, including a disease like meningitis, which affects the brain, and sepsis, which affects the blood. It spreads easily when people live close together. So vaccination is especially important for college students in dorms and military recruits. So now the U.S. Department of Health and Human Services said that all vaccines remain covered by insurance, which is great, but parents will need to talk with pediatricians about vaccines that are no longer universally recommended. That's the change. This could be very confusing and lead to lower vaccination rates. So while these changes may confuse some families, vaccines still remain one of the safest ways to protect kids. And I really encourage parents to speak with your pediatrician, understand the recommendations, and make the right choice for their kids. And this is how we can save lives. We have to make sure that we get informed, talk to your doctors.
All right, so if we have our shots and other people's don't, does that create the discord there?
Absolutely, and then you could get ill. So if you're a college student and don't get the meningococcal vaccine, and you could get meningococcal meningitis and die. That's the story that you have to understand and talk to your pediatrician. Say, hey, you know what? My son and daughter is going to college and they're going to be around other kids. Should we get the vaccine? Discuss it with your doctor. That's the idea, and we can save lives.
All right, thanks a lot, Doc.
Hey, my pleasure. Of course.
All right. If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll get it right to him.